vascular surgery, NICVD. Presenting the hardware selection for the peripheral interventions. And a special thanks to IPDI Bangladesh Live 2024. Session 30, endovascular intervention step by step in collaboration with the Ibn Sina Vascular Surgery Department. This is most of my slides is pictorial. So this is the difference between endovascular and open surgery. In case of endovascular surgery, we require exercise, crossing lesions and deployment of the devices. And in case of open surgery, we always know about the direct landing over the lesions and repair or revascularizations. And merits and demerits are everybody knows endovascular versus open surgery. Approach above the knee lesions. In case of iliac occlusions, iliac lesions and SFA occlusions. Our access site was in case of iliac lesions retrograde or bifemoral, retrograde left brachial. In case of iliac lesions, retrograde ipsilateral, contralateral antegrade and retrograde left brachial. In case of SFA, contralateral femoral, ipsilateral femoral antegrade, tibial or popliteal sites. Hardware: puncture needle, access sheath, guide wire and catheter. These are the measurement of the various types of devices per unit basis. In case of entry needle, outer diameter is measured in gauge, guide wire outer diameter. In case of sheath, only inner diameter. Others are measured in outer diameter in French. These are the conversions between the gauge, French, imperial and metronic units. 1 French equal to 0.33 millimeter equal to 0.03013. These are the puncture needles. 18 gauge commonly used for the femoral arteries or large vessels. In case of micropuncture, we always use 20G or 21G. Puncture access sites, single wall or double walled. Hardware selections for the aortoiliac lesions, iliac lesions and SFA lesions. We uses long sheath, support catheter and guide wire. In case of aortoiliac lesions, most of them we uses 6 or 7 French gauge into 90 centimeters. Iliac lesions needed 6 or 7 French gauge into 55 centimeters. SFA lesions in case 6 or 7 French with 70, 90 or 110 centimeters if brachial approach needed. From the access lesions, device should be long in length. Support catheter usually use 035 into 150 centimeters. Guide wire 035 into 260 centimeters. In case of brachial approach, we uses 035 into 300 centimeters. Guide wire. Features of the guide wire: tip shape, J-tip, straight angle, and diameter, stiffness, length, anti-friction coating. These are the guide wires. Guide wire size 035 into 260 J-tips and angle tipped. For better support, we uses Nitrex and Roadrunner. For more distal lesions from the access sites, we use Tiger wire 035 into 300 centimeters. Measurement of exchange wire length: total length of the wire from the insertion to lesions plus length of the catheter or interventional device plus 10 centimeters. 035 uses angiogram and angioplasty for the aorta and its branches. 018 and 014 guide wire is used for the angiogram of the visceral and tibial arteries. Length various of length ranges from 15 centimeter to 480 centimeters. Short guide wire 15 to 45 centimeter, standard length 145 to 180 centimeters, and exchange wire length 240 to 300 centimeters.
450.
These are the complications, another chapter. We uses long sheaths, color-coded sheath caliber identifications, 4 French red hub, 5 French gray hub, 6 French green hub. We always on the basis of the color-coded. Its length 6 French into 90 centimeter, flexure check to flow introducer sheath. This is the picture of the flow introducer sheaths. Multi-catheter, we can use diagnostic catheter, guide catheter, balloon catheter, microcatheter, and support catheter or crossing catheters. These are the type of catheters. Flash catheter like pigtail, tennis racket, omniflash, and contour 2. Single curve, double curve, reserve curve, crossing catheters, and various curves we made individually by the endovascular surgeons. Diagnostic catheter. This is the pictorial figure of diagnostic catheters, omniflash, pigtail, straight flash. These are the pigtail catheter, left one, straight catheter with internal scales, and head hunter catheters. Multi-purpose catheters, internal memory, Judkins right guide catheter. It has 3 curves, primary, secondary, and tertiary curves. These are another catheters. These are the Trailblazer, 035 into 150 centimeter. These are the catheter introduced in various arteries with their shape for arch vessels and iliac vessels. For the Biloni lesions, we approach contralateral femoral, ipsilateral femoral, antecatheter, wire length, guide catheter, and support catheter. Wire and catheters for the tortuous vessels, choice PT, and commando wire used in occlusive lesions. These are the catheters. And torque for the wire torquer. Venous lesions, we use as wire, support catheter, and long sheaths. Tips and tricks for crossing the lesions, we must need a wire with good trackability, pushability, torqueability, and crossability. Rotate the puncture site and distal end of the gain maximum torque using support catheter. Understanding sheath sizing and length is also important. We should keep in mind we must choose our hardware according to the site of the lesions and type of the lesions. Never lose the cover of the hardware because it contains device information, and careful handling is very much helpful to maintain sterility. Thank you, and special thanks to Dr. G.M. Mokbul Hasan sir for his kind help. Thank you.
Thanks, Dr.
So-
Sultan Mahmud, sir, for